healthcare sector marks a significant evolution and being recognized as an eye care solution provider is paramount in the medical industry. Talking Point connects with Dr. Saman Basnayake, CEO, Mount Lotus Eye and ENT Hospitals. Welcome to the show.
Thank you, Sabrina.
The establishment of Mount Lotus Eye and ENT Hospital makes a significant evolution. And could you elaborate on the strategic vision behind the incorporation of eye and ENT and how it aligns with the overall mission of providing a comprehensive healthcare solution?
Yes, when we consider about the new trend of the healthcare industry in the world, so the trend is that making a specialized hospital for each and every field. But those days that all together that multi-specialty hospital was the trend. But the new trend is making specialized hospitals so that you can give a comprehensive and experienced staff and machinery and equipment wise and training wise, so very good care for the patient. So in other countries of the world now, even in Sri Lanka now, this is the trend. So cardiac specialized hospital and urology specialized renal care hospital, and especially eye and ENT care hospital. So together eye and ENT care collaborate together with, you know, that all sensory organs of the human beings are very important to their whatever the life is depend on the sensory organs. So especially eyes, without eyes you cannot imagine that how we can live without vision, and as well as the hearing. So ENT means then again nose, that smell whatever it is good or bad, and when you are tasting something, the sensory organ, the smell is very important. If you smell you lost, then half of the taste will go off. So those sensory organs are very important for human life, not only human, this one animal. So we took this all sensory organ together, and normally in globally also eye and ENT sensory care health care is coming together. So that's why we thought that Sri Lanka also we have to expand these facilities as a Mount Lotus Eye and ENT Hospital.
As the CEO, how do you foresee the integration of eye and ENT services contributing to the holistic well-being of patients, and what unique advantages does this combined approach offer in the healthcare landscape?
Yeah, that's what, as I explained, that to be healthy person or good, that active person in life, you need very good vision for that. If your vision lost, then that entirely other organs and all other systems in the body is functions very well, also no use if you can't see the relations and the nature and all those things. That is very important to keep your vision healthy, as well as the hearing part. If you lose the hearing ability, then again that you can see that people are talking and some other musics are playing, and sometime in teledrama or something in the TV, but you can't hear. So then all these together is make a very good balance for a human healthy life. So not only that is even smelling and all those sensory organ working together is very important. So that's why the specialized care gives always comprehensive and evolutionally very latest technology and new equipment. All those things we can engage, we can use for this kind of specialized hospitals.
The Mount Lotus Eye and ENT Hospital has been renowned for its excellence in eye care. How does the extension into ENT services complement and enhance the overall healthcare offerings, and what sort of a role does the technology advancement play in this integration?
Yes, actually Mount Lotus Hospital is newest hospital. Just I think we just celebrated our 2 years birthday. So we just started very recently, I mean 2 years back. So when we building a new hospital, you can always think that we just using all new machines, new technologies.
That's the idea.
That's the idea. So not like old hospital. I think I'm not telling that they are not using the new technology and all, but they already purchased some machines and those are upgrading and going on. But as a new hospital, we when we are starting itself, we use this new technology and new machineries and with the latest technology.
Innovation.
Yes. So for example, now if we take I will tell now recently we started first time in Sri Lanka for the glaucoma patient in Sri Lanka, the SLT technology, that is a laser technology. I mean, traditional method and way to treat for the glaucoma patient is the basically eye drops, using eye drops. So sometime when you build up with eye pressure high, then this is a very dangerous eye problem. The worldwide about more than 80 million people are suffering with glaucoma problem. So it is directly damage the optic nerve, and then leads to go blindness. So if you, and other dangerous situation is there is no early symptoms for the glaucoma, and when you identify you have some vision problem and then doctor diagnose that this is a glaucoma, then almost your nerve is affected. So lost vision we cannot improve. Okay, so whatever the preserve vision, you can just preserve it and save it. So most common treatment is using eye drops for this. So one time doctor is using one eye drops, then when it is failed and adapted for that, then using second eye drops. Then sometimes in most of the glaucoma patient, when they are taking treatment for long time, doctor may have to prescribe another eye drops, then 3 eye drops, and those medication are also very expensive. And also then they have to, wherever they goes, they have to carry those eye drops, and also they have to put this into regular manner.
It's a trial session, isn't it, doctor?
So this way patient is suffering and they have additional headache for this, carrying these eye drops and spending lot of money for that. But the new technology, actually, it is not a very new technology. It was there in other Western countries, but in first time we proud to say that in Mount Lotus Hospital we introduced this SLT, selective laser trabecuroplasty technology. So this is the simple laser treatment, and after giving this laser treatment, we can reduce, either we can reduce number of eye drops or completely stop using eye drops permanently for the patient. And we have enough data now. We have last nearly about 6 months we have done these treatments. So we published one research paper also based on our whatever the available data for the College of Ophthalmology Sri Lanka in 1 month back for their presentation. So it was the first paper, I mean selected number 1 paper in that session. First award we got it, and that research was very successful, and all the patients who got treated from our new technology, that SLT technology, now they are not using eye drops. Their pressure is remarkably came down and it is now normal. So these are the things that as a responsible and comprehensive eye and ENT care hospital and a new hospital, we introduce to Sri Lankans this new technology.
It is a classic example, of course, yes, because you must be having quite a lot of success stories.
Yes, that's right.
With the growing emphasis on patient-centric healthcare, how does the eye and ENT hospital prioritize and enhance the patient experience, ensuring seamless care and satisfaction across both specialities?
Yeah, while we are training our staff itself, and the first thing is when you are coming to the hospital, not like the tourist people going a trip like. Okay, so they are coming with already under stress. They have physically some illness, some problem, and they are suffering with physical issues, as well as mentally they are depressed, and financially they are
drained.
They drained. So at this with the current economical situation, even people just thinking twice that when we go to this kind of hospital, that how much we may have to spend. So all this patient mind, you have to focus to patient's mind and what they are thinking, and our training was based on that. First of all, that in the reception staff and all the staff, they should be very friendly for the patient, and we have to go and ask patient, why you came here, madam, how can I help you? sir, and all those things. So that is, I am sure that it is happening in Mount Lotus Hospital, and all the patients are really appreciating our staff. And another thing, the patients are not coming here for the spending long time. So we just arrange our system wise. We using this technology and the system wise, all this thing. We are giving correct time to the patient. So hanging time in the hospital, we just reduce as much we can. But there are some parameters we cannot control, is beyond our control. But as much as we just reduce the patient waiting time in the hospital. Another thing, the reasonable pricing, the economical thing. So mentally you took care about the patient, and very friendly, you have to make the friendly environment. You can see if you walk around Mount Lotus Hospital, we always love to the nature. So always with the plant and natural environment we trying to maintain in the hospital inside itself. And patient then the facing next problem is financial problem. Of course, for as far as we can help for the patient, we just minimize our whatever the cost when compared to other hospitals. Actually our rates are very low. It's bearable thing. So in that way we make patient, I think, almost very happy, and also that is coming always with the good results. The patients are coming, without their vision, and most of the patients, sometimes 3 years, 4 years, they didn't see the world from that eye. So next day, just after cataract surgery or whatever the surgeries, while you taking out this eye patch or something, then patient can see very clearly this beautiful environment. So I think no need to explain that what kind of emotion patient will get once you, after a long time, when you're not seeing the world, when they see it back.
Very
so
true.
In that way, in all the ways, so our target and our aim is, our vision and mission, everything is based on the patient satisfaction. In that way, I think we touch most of the patient's heart.
Healthcare is continually evolving. In what ways do you envision the eye and ENT hospitals staying at the forefront of innovation and research in providing cutting-edge treatments and maintaining leadership position in the field of ophthalmology and otolaryngology?
Yeah, actually, as I explained you, that when you go for the multi-specialty hospital, for some treatment areas, their treatments are limited. That they cannot, as a specialized and comprehensive eye and ENT care hospital. So it's our responsibility to equip and make the facilities whatever the treatments available in this hospital. So that's why we call it is eye and ENT care specialized hospital. But you cannot expect this from the multi-specialty hospitals. So they have some extent of some kind of common treatments or surgeries only. When compared to that, when we come to specialized hospitals, so it should available all the facilities whatever you have. So our responsibility is not only that using the updating whatever the knowledge and technology and new doctors, young doctors who getting training and knowledge from abroad. Just recently, qualified doctors, they are coming back to Sri Lanka with new knowledge and new technological knowledge and all those things. So we have all experience. Our senior doctors also, their experience is incomparable with anyone. So, but young doctors are coming with latest technological knowledge, and they have ability to use new technology, new equipment. So this everything is there with us. So most of the very famous and very knowledgeable and qualified eye and ENT doctors are now join with us to serve Sri Lankans healthcare problems, especially eye and ENT problems.
Mount Lotus Eye ENT Hospital with a very strong vision and a mission by being in the forefront of eye care solution. We had a very interesting conversation with Dr. Saman Basnayake, CEO of Mount Lotus Eye and ENT Hospitals. Thank you so much for connecting.
Sam Bruce, thank you very much, Sabrina. Okay.